In 1993, the Center for Disease Control and Prevention in the United States of America developed a new definition of AIDS. This definition states that AIDS is considered a disease if the AIDS virus is found in the body, and this can be confirmed if the results of tests show the presence of antibodies to the AIDS virus in the blood accompanied by one of the following symptoms of AIDS. Opportunistic infection occurs when the immune system is weak or infected, such as in the case of pneumocystis carinii pneumonia, PCP. The number of T lymphocytes, where the number is 200 or less, knowing that the healthy value should range between 800, 200. As AIDS progresses and worsens, the subsequent damage to the immune system intensifies and it weakens more and more, which makes the body an easy prey for opportunistic infections. Symptoms of AIDS and some of these infections include the following. Excessive night sweats. Chills or fever above 38 degrees Celsius persist for several weeks. Dry cough, shortness of breath. Chronic diarrhea. Permanent white dots or strange wounds on the tongue and in the oral cavity. A headache. Blurred or disturbed vision. He lost weight. And at a more advanced stage of AIDS can manifest additional symptoms, such as permanent, inexplicable fatigue. Excessive night sweats. Chills or fever above 38 degrees Celsius persist for several weeks. Swellings in the lymph glands persist for more than 3 months. Chronic diarrhea. A constant headache. HIV infection also increases the risk of certain types of cancer, especially Kaposi's sarcoma, laryngeal cancer, and lymphoma, although the risk of these diseases can be reduced by preventive treatments. 4. Symptoms of AIDS in children. As for the symptoms of AIDS that a child develops, they include problems with high weight, problems with growth, problems with walking, slowing mental development, infection with common inflammatory diseases such as ear infections, inflammation of the lungs, tonsillitis. Causes and risk factors of AIDS. 1. Sexual contact. They are the most important causes of AIDS and can be infected with the AIDS virus through vaginal, oral, or anal sexual contact with a partner who is a carrier of the AIDS virus when one of these things enters the body, such as blood, semen, or vaginal discharge. The joint use of sex toys that have not been washed and cleaned or have not been wrapped with a clean condom, between use and the other transmits the infection, as the AIDS virus lives in semen or in vaginal secretions that enter the body during sexual practice through small wounds or lacerations that are sometimes present in the vagina or in the rectum. If someone is a carrier of another infectious STD, they are more likely to be infected with the AIDS virus, and contrary to what researchers thought in the past, even women who use spermicide are also at risk of contracting the AIDS virus. This is because this spermicide alerts the inner mucous membrane of the vagina, which can cause cracks and tears through which the AIDS virus can penetrate into the body. 2. Infection with the AIDS virus from inflamed blood. In some cases, it is possible that the AIDS virus can be transmitted through blood or blood derivatives that are given to a person by intravenous injection, which is one of the causes of widespread AIDS. Since 1985, hospitals and blood banks in the United States have been testing donated blood to detect any antibodies to the AIDS virus that may be in it, and these tests have significantly reduced the risk of exposure to the AIDS virus from intravenous transfusion in addition to improving the screening and filtering of donors. 3. Injection needles. The AIDS virus is easily transmitted by inflamed needles or syringes that have come into contact with contaminated blood, since the use of common tools for intravenous injection increases the risk of exposure to the AIDS virus and other viral diseases, such as hepatitis. The best way to prevent HIV infection is to refrain from using intravenous drugs, but if this possibility is not available, it is possible to reduce the risk of infection by using sterile disposable injection tools. 4. Accidental needle prick. The probability of transmission of the AIDS virus between carriers of the AIDS virus and among medical personnel by an accidental needle prick is very small. Specialists tend to estimate the probability at less than 1%. 5. Mother-to-child transmission of the AIDS virus. Statistics show that about 600,000 young children become infected with HIV every year, both during pregnancy and as a result of breastfeeding, but the risk of infection of the fetus with HIV infection when the mother takes HIV treatment during pregnancy is very significantly reduced. In the United States of America, the majority of women undergo early tests to detect antibodies to the AIDS virus, and medications for the treatment of retroviruses are also available to them. However, the situation is different in developing countries, where the majority of women lack awareness of their health conditions and the possibility of HIV infection, and where the opportunities and possibilities of AIDS treatment are often very limited or not available at all. When medications are not available, it is preferable to give birth by caesarean section instead of regular vaginal delivery, but other possibilities and alternatives, such as vaginal sterilization, for example, have not been proven effective. 6. Other ways of transmission of AIDS virus infection. There are rare cases in which the AIDS virus can be transmitted during organ or tissue transplantation, or through dental instruments if they are not properly sterilized.